morning, my dear listeners. Good morning, my dear watchers. Good morning to everyone. This morning, Depsicom Tamale brings to you a live coverage of the sensitization of COVID 19 to us. Today, we want to talk so much on Caritas Ghana and Interfaith Partnership, that is the SBCC activity on COVID 19 protocol and advocacy on COVID 19 vaccine, the acceptance of it, the access of it, and also the equity. To do that with me is Mr. Yusuf Abubakari, who is a nursing officer and also a sub-district leader for Kamina Sub and also a member of the COVID-19 team in the district. My dear brother, you are welcome.
Thank you, sir, Reverend. I'm happy to be here today.
We thank you for also accepting to come and share with us these few words of encouragement, these few words for us to know much about the COVID 19 protocols, the acceptance of the vaccine, the access of it, and the equity of it. Today, we have heard that after the lockdown of the whole country, we have come up once again and various activities are going on. These activities are going on in other social places. These activities are going on in churches and other places. Schools are opened and many are all going for some of these activities. But it seems most of us have, I don't know whether to say, we have forgotten that we still need to follow the protocols of COVID 19, and it looks as if there are many things that people do not even mind again. So we want to know from you as a health and a nursing officer, as a frontliner, what would be your advice to us?
Uh, I say a very good morning to our listeners out there. And then we thank God for our lives today. Before each and every one could come here this morning, Reverend, I think it is because we are healthy. That is why we've gotten the opportunity to get up from our homes and then walk up to the studio here to advise or admonish people on ways to prevent themselves from this coronavirus disease. So I think health is a universal thing for everybody. There's no health, there's no other thing to do in our daily lives. It's very unfortunate that our people have forgotten that we are in a pandemic. We are going back to our routines that we have always admonished us to abandon. We still gather around, we move out without face masks, we give handshakes, and then we come together in funerals and then in other social events without adhering to safety protocols that has been earmarked by the Ghana Health Service and its partners. COVID-19 is real and is with us. Currently, the country is still battling with the pandemic. And as of 7th of this month, I think the country still has about 1,386 cases. That is cases that are confirmed and are on treatment.
Wow.
As of this, about 11 are in critical conditions. And then we have some which have severe disease. Northern region currently has 25 active cases which are in various treatment centers.
Wow.
So if you still sit out there and then you think that the pandemic has gone, we can now do the things or return to our old ways, then we have to look at it. Just recently, a few months back, immediately after Christmas festivities and New Year, within a week, Northern Region recorded 12 COVID death cases.
Wow.
Within a week. That was around January, February. 12 in a week, that is a lot. So we have to adhere to safety protocols. We need to continue to wash our hands. When we are stepping out, let's be in our face masks. We need to wash our hands frequently with soap and the running water. We need to stop mass gatherings. And if at all we are gathering, let's stick to the number that health experts have advised. For mini conferences, 25 people, not more than that. And the seating spacing should be 2 meters apart with everybody in a face mask. So when we do all these things, we are very sure that we are protecting ourselves and our families. Once I get infected, I'm going home to my family. It means that I'm going to expose my family to the virus. So what we are advising is that it is not over. We are still battling with the pandemic. And all the safety protocols that we are entreated to continue to observe. And the unfortunate thing I've realized is that some institutions too have abandoned what they are supposed to be doing. All institutions were taxed not to allow customers in without face masks, hand washing. You get to some institutions and you realize that there's not even hand washing facility for you to use. You get inside, their sitting arrangements very poor, and then some people are there without face masks. This is very detrimental to our health. We are exposing ourselves and exposing our community to this pandemic. So let's intensify the safety protocols. Let's make sure that all our customers wear their face masks, wash their hands before getting access to your facility. It is because we are healthy. That is why we are running a facility or an institution. If we are unhealthy, the facility would be closed down. There wouldn't be anybody around to patronize you. So we want to advise listeners and the general public that we are still with the virus, and day in, day out, we are recording cases. The unfortunate thing is that the publicity has been done because we don't want to put fear and panic in people. We want to manage the situation. But that doesn't mean that we are done with the virus. So let's try to encourage each other at our various homes, at our churches, our mosques, in the markets, at our workplaces. Let's intensify our hand washing, the use of the sanitizers, the social distancing protocols, and then we can all as well prevent ourselves and our nation from this deadly pandemic.
So, dear viewers, if you are watching us from Depsocon Tamale Studios, today we are discussing about COVID-19, which it has been a pandemic for the whole wide world. And we have also realized that just after the lockdown, many people have gone back to their old way of life. So today we have in our studios Mr. Yusuf Abubakari, who is a nursing officer, to educate us on this. You could ask questions with the mobile number 0243 747-387. 0243 747-387. You can WhatsApp your questions or text your questions, and Mr. Yusuf is here to answer us. My dear people, one of the things that we've also heard, which is very welcoming, is that the vaccine has been found, and a number of them has been sent to Ghana so that the health people will be vaccinated, the military, the social workers, and other people, those having underlying medical health, will also be take this vaccine. There have been many talks on this vaccine, and you could hear people even saying that, are they bringing this vaccine to come and change our DNA? Are they bringing this vaccine to come and weaken us? Are people taking this vaccine so that all the Ghanaian populace will die in order that the country will be sold out to some people? This has been a concern. What do you say about it?
Yeah, it's very unfortunate, and it's untrue that a vaccine has been brought to change our life or to wipe us out as a race in a country. And before I'll touch on that, I'll just do a quick summary of what's the first question in Dabani so that others who don't understand the English language can also benefit.
That's welcoming. Thank you.
Mpola mabe dasba kaini zongo dapselo ngo fisherman yale COVID-19 yetwa. And Reverend Boama Mazanchang daba yongo dongala tichela tamang bubu zang palala duru ngoma pulu zang bai. Karinyala tenda kumbi biya shangane katalan lap tebe katam ne duru kana tebe tesane karatumi ne tebe biya shale de yanche katetu tai de ngutu man kachela la duru ngoma. To kan yare ne mabihi the tune te bang ne tinjia sa ashara wakati da bisham katalan biama ntaya ka gana kunku katamal kunku den yala andune ya za ya to dan kana nta dam da dam bi kam karatu mene te ta bihago ka ko so chipse den yan nan ka to buta man ka ce lala duru ngama ntaya bi akam batire tane te pansere te no pa abo kara yure katalla ande zamani haliti yan la'am da batu na ta gare ta galse ya ai ta shishe be tin yan ji ni sham zamane ba wote dan yan zana be dan yan zana ra ko ka ta ji ni sham nta anwa ma zaha ta zangala me in zan lab gone kala ba ta be ta bi hakurane be ya ta ne tere tere ta nuhe nta aya ta na kul nan da lame ka mbor nan pang sitam ma be ma doro ma ba chan da ku biya ne kana kurte nta aya tanta to la an zama dan bare December halna ne January den na bo be den nyanga tranye durungo ne yisne yasham den da bahara shaba dara panseme kaban kire karin yala duruma ko ba kara panse zo de tune te bang ne duruma na ba chan da na be ne tanama bon wo ta ne tanan shama nu pa abuma tara la andama de zaha de tumene ter pansarle de batu ne te chele zamba ay malashi to aw bi amala tuma shi ka la anda nirba de tuna bu kom pa abo nzara ka ba pahara mun kam yan kena choka o mai nangbam bi ngi pobargula foi kana to kena ka aminu tanan da dirbu nta no kwen yel biara shari zanchang first question ma follow malama, and we'll go back to the question you just asked about the vaccine.
Sure.
If you look at it, Ghana is not the only country that has taken the step to vaccinate its citizens. Several nations have done that even before Ghana went in for the vaccine. And currently, the vaccine Ghana has gone in for, the AstraZeneca, has been used by several nations, which is proved to be 80% effective in controlling active cases of COVID-19 and then preventing about 100% severe disease arising from COVID-19. So if what we should do as health or frontline health workers is to educate our people to understand what has been brought to the country. Currently, this vaccine that has been brought, I'm a health worker. I have received my first dose of the vaccine since 26th of March. And I'm healthy, I'm moving around. I have not changed. Some say you will change to a bat, others say your DNA will be altered. I don't think my DNA has been altered. I am still normal and I'm going about my daily activities.
Before you even go on, I also took my shot last week.
So sometimes when you look at this, these are just myths that have been brought or associated with the vaccines. The vaccines is very safe, and sometimes it may come with its associated side effects, but they can be managed appropriately. The vaccines currently has been ruled out for all health workers in the country. And then by end of this week, I think we'll be closing the chapters on health care workers vaccination. And the next step would be to go into the general populace. So I urge everybody, especially health workers who still associate themselves with those kind of thinkings, to come out. Please, let's take the vaccine. People have tested it. Those we say are bringing it to kill us, they have tested it on themselves before we went and then procured, and then we are now using it. And since it is brought to Ghana, I've not heard that the vaccine-associated side effects has killed someone. There have been issues of recording of adverse events following the immunization, but none has been fatal. So we need to understand that the vaccines is for our own safety. If you refuse to take the vaccine, it means that you are being a threat to yourself and the family, and then the nation as a whole. Your life is as important as anything. So let's try and then embrace the vaccine. It's very good, and it's supposed to protect and prevent us from getting the disease. I'll just talk more on it in Dagbani.
Yes, that's good.
Entire thing could COVID-19 yet to her, but vaccine na. Ka vaccine man yala den yanye ban chibrgo ka chibe karatu ta kachi lala duruma. To din yina halno zungo nirba pam yara ya to abiare be ka tale dare. Nirin yara ban sha'aban zangna na bata zan kute. Na bi ai chible nta aya dem pa chira sham nyanga anyala ngwen pibe anyala dwara iwel ni angbaage kara ne to kuwa. Daba nang yamangale. Nta aya ka zungo ka ba pele vaccine zankana. I chant to you kurumbuna ha. Te banam ne yisana banko aduru yellow fever balbal fiab nta adara kulin yala ban sha'aran beti jinial ne kaso kam yarle zungo bole che karlan kane tin chibra lala be ma shatta bannan ye za'a polala karache karata ai ka ku kal lala dwatma ti jinial ne za de kotom sim bon ma ka basanga na ai chibla la COVID-19 vaccine wama din yala den yantu ta ka buwa ka ce ka bala la duruma be kala la duruma itiani karani to wulge inta barna torozo o de ban yal mangle so yala yani ai chible an lela kpare be ai lela janga da pala yal mangle lala vaccine man yala ban sha'aw ban malama mamman na zangle nan wulan tumtuma ba zangle chib ban manga nya din yesham ka vego vihi zan chang de polo karin yala dam yala ban sha anyan to chib kar mal bukata danta de ba abande a chible nya na nyanga amara ka barna shali tin tarbe tin zan parla ngoma de zo che ka te zon yirani ka gu be ka dan mal shil gulle di kana ka tien chibe ni je won chible me mi ne chible de gare bakwai de ba yi janma ban sha abanan ma yato ashel ba muqsima na wasu wanya mana lalan zang dan kanna vimana kan chipa kai pa mi ne pumpon a malen nan gono su janam na rabuma kace COVID-19 do dizuɣu di tuni ti zaaha yuli dizuɣu ka kpaŋsi lala shɛrigi ŋɔ maa chibbu di nyɛla din viɛli pam a yi zaɣasili chibbu a yɛn niŋla amaŋa ka tom niŋ a iyaali n tom niŋ n tabili ti bin zaaha n nyɛ ʒiʒii ni tabi ni nyini la dizuɣu di tuni ti yuli lala yɛltɔɣa ŋɔ maa zuɣu ka kpaŋsi ka ti guli lala shɛrigi maa di yi kana ka ti yina viɛnyɛlinga n ti chibili ka di tooi taɣati ka chɛ lala doro ŋɔ maa.
So I want to thank you once again, dear listeners. And as I said, today in the studios of Depsicom Tamale, we are having a discussion on COVID-19. And this is from Caritas Ghana and Interfaith partners who are the SBCC activity on COVID-19 safety protocols and advocacy on COVID-19 vaccine acceptance, access, and also equity. So, as we discussed this with Mr. Yusuf Abubakari, who is a nursing officer and a sub-district leader for Kamina Sub, and a member also of the COVID-19 team in the district. We are also asking that if you have some questions to ask on the access, on the acceptance and the equity of the vaccine, you are welcome to do that. You can WhatsApp or text with the mobile number 0243 747 387. 0243 747 387. Send in your questions, send in your doubts, send in whatever you have so that we can put it forward to Mr. Yusuf Abubakar, who is here to help us with the discussion. Mr. Yusuf, the other thing too that has come in that you have expressed so much is that you're encouraging us to go in for the vaccine.
Yes.
So that we can all protect ourselves, protect our family, and protect the environment. One of the things that people are also asking for is that people go in for the vaccine, whether it is psychological, it is social, I don't know, but they are complaining of having headache. Some people, when they get up early in the morning, as people used to say, their body is doing them something. People also complain that they have strong headache, others malaria, feverishness, and other things. Others will even tell you that just after taking the first jab, that he couldn't see well, whether it is psychological or what, we don't know. What do you say about it?
Okay. I think what we need to understand is that every vaccine or every drug comes with its side effects. And then, if you look at even the routine vaccines we use at the health facility, we have some associated side effects. And the side effects are not supposed to be life-threatening. They are just normal reaction of the body to a foreign substance in it. What it tells you is that when I take my jab and I start to get some low-grade fever or some headache, it is telling me that my body has seen that there is a foreign substance in it. And the body's immune system is trying to build defense against that foreign substance. And that is the main reason why you are taking a vaccine. The vaccine is supposed to make your body immune system build up defense against that virus that would come attacking after. So these are signs that your body is actually trying to produce that defense, and that is the main reason why you receive or took the vaccine in the first place, except in cases where the side effects are severe or comes in life-threatening forms. And with this vaccine, they have not recorded such cases. Yes, it is true that some people will experience headaches, others will experience general body pains, others will experience low-grade fever, others will feel like vomiting. All these as a result of the vaccine you have that has been introduced into your body. But then they are not supposed to last more than 3 to 7 days. The mild forms last within 72 hours, that is within 3 days. Some which may persist up to a week. Okay. And the highest number of days you will see some of these symptoms is within 10 days.
Okay.
So it is normal when you take, even at the routine vaccines we take, we tell mothers that when you go home, your child might experience fever. Just bath the child and then leave the child. When you think that it is getting severe, you can just give paracetamol and the child will be okay. And it's same as this particular vaccine. When I took mine, I was very normal.
Wow.
Till in the midnight that I started feeling that I had some fever and then some general body pains. Because I am aware that when I take the vaccines, this is what would appear. Yeah. I was okay. By the morning, I was fine. I never experienced anything. I had a colleague in the morning who called and said, I couldn't sleep the whole night. My whole body, I had fever. I said, oh, you should have called me. He said, oh, I didn't want to disturb your sleep. So what should I do now? I asked, do you still have the fever and headache? He said, yes. I said, just take paracetamol. And when he took it within an hour, he was okay.
Wow.
So sometimes it's the education that we give out after we have given the jab. When you understand that when you go home, these are the likely symptoms you would get.
Yeah.
And they are normal physiology within the body.
Exactly.
So when we understand that these things comes, yes, they are normal.
Okay.
And then in severe cases that we need to report immediately so that we'll be asked or we'll be told what to do, like in the case of my friend.
Okay.
He wasn't aware that when it is severe and he takes paracetamol, he will be fine. And that was done. And within an hour, he was okay.
I see.
So these vaccines comes with these side effects. And when you take it and you start to experience it, yes, it's normal. But when it is two-way disturbing, you can call your doctor or you report immediately so that you'll be told what to do. Others took it and never even experienced anything. Some people will say that after taking it, they have pain at the injection site.
Exactly.
Yes.
I also felt the same.
Yes. And within some few hours or within a day, you will see that it will go. Yes. There are normal physiologies that the body will react to the vaccine in order for it to what? Prepare that defenses you wanted the vaccine to do for you.
So, my dear listeners, my dear viewers, we are still on COVID-19 vaccines. We are still on protocols of COVID-19. We are still looking at access and its equity for us. As I said, you could send your questions to mobile number 0243 747 387. 0243 747 387. Some few questions have come in, but I'll still ask our brother, Mr. Yusuf Abubakar, to explain what he has said in Dagbanli, so that afterwards we can flow with a few questions that have come in.
Nsa tanko yare ya to ashalmela COVID-19 vaccine de tim shari tanchibre nate butaman kachi COVID-19 duruma. Shabto so ya kabe na ben chible ben ya yara mu usra kama zo yale nan bon zole ka shabe yale na ben yara biaram ben nan bunu zaha kare biara ben yala yala mangle simma na kanna ne yala mu usra bi shangam balama ai chip simma den to nan kan yar lala yala mu usra ma to ama da pala sa ya an yala den yala sa afiyalle den ya sa afiyalle sham yala ai chip timma nan bunu ne nan bunu ma yala den yan yetin ma kara pala ben sha'aw dan buara to roso de yan yisma zane mbo soja bi nare to lala ben sha'aw an zan nan anan bunu ne ma nta ayata mi ne rafun chibrale buar ya to ashalan bala a chibla kanan bunu to yis zane nye de soja na ma nzan le nta aduru kam ne tabar sham bala ma ai tin ya ka duru yina nan bunu ne to runguna nan bunu soja na ma to le miji Karanyangle, Katu Yipolona, Kanyalama. Durona Baga and Page Dapsaba, Kanangunoma, so out of Torle, Kabacheka, the Sohara Torle, Nala the thing young Lan and Gunoma, Kana and Wula, and Yipulu Kamas or Yalebi and Guntole. Toroso Olaratim Wama, I chibly, Kanyala Ben Yarma, the Para Ben Shao Ben Zadia, Ben Yala Zadia, the woman and Gunushir Tarman and Zigi, Lala Timwama. Toroso, Tung Panser Sham Yala, the Kana and Gunuri, then Tobian command Dapsel Halene Dapsata, Shabden the Tobian Tapakaman Dapsa, a point, Tonque and Ruya command Japia. Tama Tele Panserme, I yard and Hala Zongo, Kanya Karamala, the Malamos or Yard. Well, my doctor be well me, ella to my yelma. Tingala ben yon waha, anyan nosham, Kalala, Yelmo Sarama cham. Inside Lala, Yelmo Sarama thing Yelma, the palace at Jao. Then two canani, di canani. Tapsel Punibi, Dapsai, Karacham. The Palaban Shadan young Baragadi is on Son Kakulan to Kubukata. The Wuhrame Nungunoma, man, actually, Nere, Male, the man, Ungwa, Kachi, Lala, Duruma. So odon tu na tabang shambala da ba wohore ni anya la ben ya harma tin ma ba shi yalme anta anan gono tan la yan cheka ne ba zuwan yi ben sha anan yala nda anya ka shafto yala ni ti yala ne di yam mo so mun valma parastam na ron ran wundi yin vala kana kana ti chibe nta ya kalala into na ran yele anto chibele karaba dama ni to chibele karaba dama ma so ni to chibe karaba dama yala da ba goma na ai hi chibele shi kara dama toroso tere bare yara gon wo hora taban sha'ani di na wa bi yara na nan shale nan da foi di ba wo nan a ya to a shale don wala tan da fun buwar shambara amma di yan dama me dan ye a fane simila toroso tun ko yar biara shabi zancan lala timma ko barama.
So some of the few questions that have come him now is that some want to know, for how long should one wait to take the jab, the second jab, after taking the first one?
Okay.
And the second question is that, what are the side effects of the COVID-19 jab? Both we have mentioned headache, we have mentioned maybe diarrhea or feverish or other things. Can you give us more of the side effects so that when people feel it, they know report, that they can report how mild it is, how harsh it is.
Okay.
So these are the two questions.
Okay. The first question talks about
for how long?
For how long? Yes.
You wait.
When you take the first jab, within 4 to 8 weeks, you can take the second jab. Why? When you take the first jab, it takes the body 2 weeks in order to build those defenses you are looking at. And that is the reason why we say that once you take the jab, still maintain the safety protocols, still wash your hands, still use the nose mask, because once you've taken it, doesn't mean that immediately you are protected. So within 8 weeks from the initial first dose, the second dose should be taken as a booster. And with that, we are good to say that your body would have what? Produced the defense systems for the COVID virus. And then we look at the second question. You see that some people, what we are mentioning is the basic ones, or the more often occurrence symptoms. That is what we have been mentioning. But associated with the drugs, some people have reported redness or soreness at the injection site. Others have recorded muscle aches. You just sit and every part of your body, you feel like it is painful. You feel fatigue. That is general body weakness. You can have chills because of the fever. Then some people say they have they felt like vomiting. Others say they vomited small. So all this, everybody with the way he or she reacts to the vaccine. We will as well record even new signs and symptoms or side effects associated with the vaccine because the FDA has given a portal where when you can report if you feel unwell, the nature of the symptoms, so that they take into consideration and investigate further to see the symptoms or the side effects associated with the vaccines.
Oh, okay. I see. I see. So these are some of the two questions that have come on, and as well, can you also explain this in Dagbani before we go on with the other questions that have come in?
Okay. Nsa tamabe so bohaya ne te nya ai chip shargama wula karayan to be dabsala karayan to pa talan chibe dampayala nsa ya katiyal ne de zara pakwai de ban ai hal ne pakwai de ban ni de sunsune anto chibe sharage dampahara yima de me charin yala la ma yala ai chip sharage den ye yimla den zang ala kama ba koy de bayi kanan gunu ma to zang le in ku bukata sheldon to ne zang ku ka foi ka ananto yalne shargama tumtuma to rozo de nan la kama ta ne ai chibe pilguma karanya de tuma foi karna lam chibe dan pahara yila tumpahe ka somi borno bangnya ne te yale ne yal mo sarbi shanga biana zanchang timma ai chible na de yes katiyane shabiane ai chible naage atonye ka an chible be ben chiw shel poluma karamoge ka shabene badan nan dala yum ka shabmi yane banan gbuno za biarme bi to chible naage shabmi jene de to chekabe tsira be kabe be belonde ka betsira ka shabmi yalne de to che ka banyare nan gonjole be ka bani walgo kulitsar bame torozo lala banwama timma so kam no yen chible kato nye yal mu usrabe shanga da pumne torozo udan drasbo nim yila ban zangzare din yala a chibla tim ngo kanye yal mu usrabe anto ntite lahabare ka bazang la zang pai timama begu yeto apune zaya tan ku yal biara sham silmin silma ambalama.
So we also have some other people that are also asking some questions. As I said, you can send your questions to the WhatsApp number 0243 747 387. 0243 747 387. Some people believe that there is no COVID-19 in Tamale at all. Others even believe that, but the number has been inflated. Again, money from the government, that is, you take on that particular thing. So they are asking, the question is that some don't believe that there's COVID-19 even in Tamale at all, which you spoke about from the beginning. And others even believe that if there is no, but the number is being inflated in Tamale. So why should, if there is not, and the number is also being inflated? Again, is it that government has given us some money and that is why we are just doing all this? So the person wants to know, what is your stake about this?
Okay, what we want to understand is that COVID-19 is just like any other infection within the health system. Why it is too paramount or why it is being talked about is because it is a pandemic. It's affecting the whole of the world and it has become a public health emergency. So that is why emphasis are on it. What we should understand is that why should we inflate our disease rates or our burden of disease? Why? That is the question we should ask ourselves. I want to admonish people who really want to see or who really want to know that COVID-19 exists to contact us or contact the team at the Tamale Teaching Hospital. We have treatment center at the Tamale Teaching Hospital where people who have severe form of the infection are hosted there. You could go and then have a feel of this. Another issue I think that is making people believe that the virus is not real, is that, or the disease is not real, is that because of the mild form of infection we get here.
Oh, okay.
We
Okay.
get a mild form. Almost 80% of
Okay.
the infections we get here are mild forms.
I see.
Some comes without symptoms, what we call asymptomatic.
You thank God.
You don't have any symptoms, I test you and I say you are sick. So you feel like, no, once the symptoms didn't appear in my body, it means that I was not sick. They are trying to falsify a result for me. That is why most of our people, that is what most of our people are thinking.
I see.
Yes, and that is the nature of the disease. It can remain asymptomatic in you for a period of time before the symptoms start to show. Or you can have symptoms and even test positive, but the symptoms are mild. They come in a mild form. They are not life-threatening. They are just like the normal catarrh or cold you have. Once you take immune boosters or you take copious fluids, you are okay and you move on with your life.
I see.
That is the nature of the disease here.
Okay.
So majority of people you test and you tell them that you have COVID, and in the next 2-3 days, the person feels very normal.
Wow.
And the person can go about activities. It feels like, no, these people are falsifying results. And let me make something very clear. We are not being paid for diagnosing anybody or for saying that. It's a process. When I take your sample, I am not the one to test the sample. The sample is sent to a laboratory. The person testing your sample doesn't even know you. So why would the person falsify results for you? And the person at the lab is not paid based on what? On the positive results he or she gets. I think even government still owes frontline health workers. So if it was money we are getting in it and testing people positive, then you could have said that it's because of the money. So please, it is just public health response. When you are tested positive, you are tested positive. If you have tested negative, you have tested negative. The fortunate thing we have is that the disease burden here is so low. When you go to the Europe, America, and then Britain, you will realize that it has killed a lot of people.
Wow.
And they are still recovering from the burden of the disease. We are just being lucky that here we have the mild form of the disease or the infection, where somebody can test positive and still go about their daily activities without any problem. And within the 2 weeks of self-isolation, the person may test negative again.
Wow.
So that is the reason why people think that the disease is not actually present. We are making false positives.
Yeah. Thank you so much. Keep your questions coming, as I said, into the WhatsApp number 0243 0243 747 747 387 387. Keep your questions coming through. Mr. Yusuf, I also want you to explain this answer that you have given to us in Dagbani, so that listeners will also benefit from it.
Okay. Nta tanko yel shale bela ma nyala Reverend Bohama mazanchane tama biso mboharani dangmala te bahara la be te zumar la jere zanchang nemfo shawe la duruma na bahara be tan nang de vego ka duruma bahara nemfo shawe ka be dalirin yara na tan nang de ma gwamnati tsartala lore kan yalne da pala yalma duru yala duru bozo kaya ngajir pasone duru mulu karaba mulu na wonu yuti sham yala duru ma ya be dem be sham da balla chon kana to nya ka so biane ka ya to ashere ngahande shere ko nan gbono no biara to ama ka nan bihu karan yala duru ma mulu ka so mi biane ngahande shanga den yam joni ma da ka be do mo so da kayya dan na to non wala dan na to ko be dan na to barbo zan so ama ile vi kuma karin yara duru ma malo kalala zo ma che kara pambiane vi kuma kara biane kalala ba duru ma be lebo son tan banma wayam ne shirki mara nung binye to am osor sheldem yu nung bono de so odoro ma ba mulu nta ya de za hanyala jilensi ai po ai azo ozan yule tanduya ne nta adoro ma na kurva ma ba yishel yala di gba bar kul na handala ban vien yalan kan bar gaba to ama tan nguna so ne to bian ba ka yalta am osor la ba bino wonan bono ne ama ka doro ma le mulu nta ya den cheka ni rabat pamtu zahara ne te ngbar la jiri zanchang lala duruma fulu balama and island kana ti yule te vego bo wona ti yula be ti chanta nan vego ma ka duruma mala ka daba laba song be kar kayato amosra te zanga changa shifte to song ti yala pana ben de kane toroso di nang la ti yang wahala an yan be sham ayanga an yan dir kan yor sham kato nye ti shanga zanta ka do yan yura ba ko de bayi ti chanta lan be go ma yan yama ka duru ma lan kan toroso onir ba pam da ya ni bang tang bar bala jere do me on to kul mbiane kaya to ashere katim shere ka be to katlan yelo ne duru ma ko nan guno nta ya na wono yu te pam ka duru ma kara kana la am usar la ma ba kana piton kar yala da mal suci in yala kare be ne tanma da so dan tune ta ban shambala.
So, as we were talking about it, within our third question, we were asking that the effect that this COVID-19 vaccine brings to us, how is it that once the effects are there, we need to still take the vaccine, and how it will be cared? Mr. Yusuf Abubakari have helped us to know that yes, definitely there would be some small or mild effects that we may have, but we can still call our doctor, we can still go to the facility, and they will be able to help us. Some questions have also come in, and the concern is that our weather here is very hot. And if it is very hot and the pandemic, have research have shown us that when temperatures are too high at certain times, well, you know, the virus cannot exist within that particular temperature. And taking tamale, for example, sometimes when you even go under the sun, you realize that we are beyond even 42, 44, and other things. Should it actually be so much? Should we be worried? Because our temperature has killed the virus already. And once the temperature has killed the virus, what again?
Okay.
Is it also because of that? That is why we have low record cases in Tamale. This is the concern of one of the listeners.
I think it's a big myth that when you are living in a high temperature and you don't, or COVID stuff can be transmitted. It's a myth.
Okay.
Yes, it's a myth associated with the disease.
I see.
Then let's talk about those living in this desert area. They shouldn't have any COVID.
Yes.
They shouldn't record any COVID.
Yeah.
Because approximately all year round, they have high temperature.
That is true.
So this is just a myth. What they are talking about is that the virus doesn't thrive well.
Oh, okay.
It doesn't thrive well
Okay.
in a hot temperature.
Oh, I see.
It doesn't thrive well. But that doesn't mean that it cannot be transmitted.
Sure.
If you look at even nature of viruses, temperature affects them, but not that much.
Mm.
They only require some temperature to thrive well or to be able to multiply.
Oh, okay.
So when you say that because you are living in a hot area, it means that you shouldn't protect yourself. It means that you are free from the virus. Then let's compare to those living in these desert areas. they wouldn't even record any single case of COVID.
Yeah.
So what we should be aware is that let's take our safety protocols very serious. It will still thrive when the condition, or it will still multiply when the condition is hot. It doesn't matter. So please, these are myths that are associated.
Yeah.
Some will tell you that drinking alcohol would prevent you from, just because we say we use alcohol to do what? To manufacture spirits.
Yes.
So you see,
yeah.
they are doing direct linkages.
Sure.
That while you say you are using alcohol to manufacture spirit, which can prevent you from this, and then I'll drink the alcohol into my food to prevent. Yeah. Unfortunately, the virus is not in your stomach.
Exactly.
So it doesn't have any use.
Sure.
The virus is at the surfaces.
Yeah.
You breathe in the virus.
Sure.
So where you are applying it, it will never work for you. So these are myths that we should discard and then observe our safety protocols with all our seriousness.
Okay. So dear listeners and dear watchers, we have some few minutes to go. We have about between 10 minutes to be out from the studios of Depsicom Tamale. And today we are discussing Caritas Ghana and Interfaith Partners SBCC activity on COVID-19, safety protocols, and advocacy on COVID-19, the vaccine acceptance, the access, and also equity. In doing this in our studio, we've invited one of the nursing officers in Tamale as a sub-district leader of Kamina Sub and also a member of the COVID-19 team in the district. He has helped us to understand these things, and some few questions still come in. You can also send your questions through the WhatsApp number 0243 747 387. Send in your questions. We have the next 7 minutes to be out from the studio. My dear brother, Yusuf, can you also explain what you have said in Dagbane in terms of some people saying that once you drink alcohol, you'll kill the virus in your system and nothing will happen?
Maybe tena ko bobla COVID-19 yeto a zanchang yeto a mo serchang be yeto a shanga tamare nzang mparle karpa yamale. So to yare ni ai be shel pulu tulum ne biantam. Nsaya la dorongo debe bara be la duruma kan amane. Ka shabe ni ai to nyu dam ai nyu dam ma nan da pe nsaya de ngwa makachi la dorongo. Ka ti yal ni de zanya la yeto a umsara. Che barba filan yale ntaya be bo ti table la ban ma de yala yamale boleche karpa yamale ay wele la duruma de yala dor share de nye anan nan gununi nin foso ngum malle kato nyale de bo wona duruma jala afulne ami yor la damo mal nan da afulne damo mi be ci duruma mi be tola afulne ka damo yan kana ta polle kato nan wala ku la banim bi mama de so dam de para ben sha ayan to ta aman ka ce corona virus dam nirbe zang le yule sham yala nta aka ta yule ba shanga tamare man da tunola ka ta bona da sanitizer nan ma nta ya dam to bi la ba mama ne ka ba mal ma ne ka ran yala azang le so anu de azang le mele a jinere danan ye ben sha adan na to ta ama ka yule zan nan afulne ailan kana ti yule nta bin yal no tulum ma nta ya ka tulum di imbiane ngohni lala ban ma lala ban ne mbe ma yan pimi tan yu no tulun sharma ko to ku lala ban ne mbe ma en lala tulun share tan lan yu no ma to mena taban na ya lala tulun ma ko bian me kana anche ka ban ne mbe ma ti yale ni ka nirba to fu horlame en zande mbaharana so tulun wo ba para la dala ampulni tulun wo mi ninge tulun shalma ko to kulala banne be ma to rozo da tuna tabanda lala ban yaɣari maa ku nyɛla yɛltɔɣa ŋumsira ka niriba zaŋ zoogi bee zaŋ pa lala doro ŋɔ maa din ku tu ni ti kpaŋsi ti nuhi paɣabu shɛm din ku tu ni ti kpaŋsi ti nyɛha pɔbbu shɛm la din ku tu ni ti kpaŋsi ti ʒi nɛli ni ti yɛn ʒi ni ka chɛ ka polo bɛ ti sunsuuni shɛm din nim maa n tu ni ti kpuɣi so chibsi n dola ka chɛ lala yɛltɔɣa ŋumsira maa yɛltɔɣa ŋumsira maa di tiriti yɛlli pam so yɛli yɛltɔɣa ka dihigu bee vihigu bi dihili tabili ka a zaŋli zaŋdi tumdi tuma n tiɛha di tiriti yɛlli pam di zuɣu di tu ni ti zo n yi lala binyahari maa ni n paɣaya pam ni a yi wum lala yɛltɔɣa bee a yi nyɛ lala yɛltɔɣa ŋumsira maa ka a tooi zaŋli bɔhi ŋun mali di baŋsim n nyɛ ni wum shɛm bee n nyɛ bin yɛli shɛm n tiɛha nimaani ka ti yɛn neegi a ni zaŋ chaŋ din shiri nyɛ shɛli ka a gba baŋ ka mali li tumdi tuma din nahandi ti kpɛ ŋɔ pam nyɛla ti social media maa di ku domi so bi controlirli ni yi kpɛ nimaani ni yɛn tooi yɛli yɛltɔɣa shɛli n opinion n ku yɛn yɛlimi ka chɛna ɛn mi ni yɛri maa niriba yuunimi ka wumda bin gba yi wum bin kpuɣurilimi ka di nyɛla nimmohi yɛltɔɣa n bala domi ni duna shɛli polo ti yɛrili yɛltɔɣa maa n di tu ni ti zo n yi ka chɛ lala yɛltɔɣa ŋumsira maa ni dii niŋ ka a yi wumlimi ka bi mi di gbunni zaŋli bɔhi ŋun mali di baŋsim ka o wuha din tu naa niŋ shɛm ka niŋ shɛm ka niŋ shɛm bɔŋɔ amaa ka yɛltɔɣa kam bin dii zaŋdi pari nimaani n niŋdi yɛlimaɣali n tiɛha a yi kpuɣi a nuchee baŋ a yuli an tooi ku kali lala yɛltɔɣa ŋumsira maa ka di gari bin pihinu ka di ku yaa di zaaha di pala yɛlimaɣali di zaaha di pala yɛlimaɣali tin ku mali list 5G network distance shɛba yɛli ni di zaaha ni di taɣarila COVID-19 ka di pa yɛlimaɣali so yɛltɔɣa ŋumsira maa ŋun yirina pam to di yi lee yina kpaŋa maŋ ka a baŋla di gbunni ka naan zaŋli tum tuma a yi di kpuɣili lala an ti n zaŋli n ti a maŋ yɛlli to di zuɣu ma bihi chɛliya ka ti wumdi ti yɛltɔɣa bin mali di baŋsim sani kamaan tin ʒiya ŋɔ n yɛn yɛli n yɛrimi ka di nyɛla yɛltɔɣa shɛli din dihi tabili yɛltɔɣa shɛli bin niŋ vihigu din nim ka ti yɛri baharina ti bi yɛri yɛltɔɣa ŋumsira to di zuɣu ti kpaŋ yɛ ti maŋa ka ti na ku doli bin wuhi ti ni ti doli so chibi shɛŋa n tooi gu ti maŋ maa n tiɛha din niŋ kamaata ni nyɛ shɛli n bala maa.
So, my dear listeners, my dear watchers, today we want to thank God for having this program to sensitize us on COVID-19 protocols, which is an SBCC activity on COVID-19 protocols and advocacy on COVID-19, the vaccine acceptance, its access, and equity. The one who have helped us within this period is Mr. Yusuf Abubakari, who is a nursing officer and a sub-district leader in Kabina Sub, and also a member of the COVID-19 team in the district. We are grateful for you and making time to watch this particular sensitization. The message have gotten to us, and all of us need to play a part in making sure that we send also the message to others. Don't let us skip it. It is a pandemic that is affecting you and is affecting me. It is something that we need to eradicate, if not at all, but to see how best we can live with it. So once it is an education for each and every one of us, let us also, those who have heard, send the message to others. Mr. Yusuf, I'd like to thank you so much. I'd like to thank you so much for making time to come to the studios of coming to the studio this morning to help us also. I would just want you to have your final word to the general public.
Okay.
Your final word to the general public.
My final words is just that health is our topmost priority. When you are healthy, you are going about your routine activities or your daily activities in peace. If you are unhealthy, you cannot do any other thing. So let's not joke with our health. Let's always make sure that what we are advised to do, we do. What we are discouraged not to do, we leave it. I want to thank everybody, especially our listeners. And I'll thank you very much for that opportunity you have given us. I think SBCC has been our topmost priority as a health organization, because when your people have the messages, the kind of messages that would help them live healthy, then they will continue to apply them and they are able to live healthy as expected. But when they don't have that information, you see that they engage in activities that brings risk to their health or bring unhealthy living habits. I would like to thank all my staff at Sanarigu District, especially the District Director, the DHA, and all staff of Kanvili Health Center. And I also thank you so much, because these platforms we are using will reach out to a whole lot of people out there. And I think we should get this more of the time so that we can educate the public on this pandemic. Thank you so much.
Thank you, Mr. Yusuf. And thank you for coming to the studios of Depsicom Tamale this morning. My dear listeners and my dear viewers, we also want to thank the technicians who have been behind the studios. We have Moise Ibrahim Abdel, who has helped us with camera work and also with lightning and with all other things that have brought this particular show to you. We also want to thank in a very special way TADO, that is the Tamale Archdiocesan Development Office, who have made this also to us so that within the Tamale metropolis, within Ghana and in the whole wide world, people may see, hear, understand, and also educate others on this particular program. We also want to thank the studios, those who have helped us in one way or the other, and also thank each and every one of you, our dear listeners and our dear watchers, for making time to be with us. God bless you, God keep you, and God continue to direct us so that we may care for this pandemic, as I said, and if not, manage with it as we live with it. We know that God is capable of doing everything. There is nothing which is impossible for him to do. Let us also thank Caritas Ghana, who, through its instrumental, have also been helping the bishops to bring the sensitization to us. We want to thank them so much and pray that God will also bless them in all that they do. On this note, myself, Reverend Father Joseph Saki, the Depsicom Director of the Tamale Archdiocese, would like to thank you from the studios of Tamale and ask that you continue to pray with us and follow us on our YouTube channel, which is Depsicom TV Tamale, and on our Facebook channel, Department of Pastoral and Social Communication, Depsicom Tamale, each and every time that we bring before you these and some of these programs. God bless you, and bye-bye to all of you. Have a wonderful day. Mr. Yusuf, thank you so much.
Thank you very much.